I am wearing purple today in honor of World Alzheimer's Month. As a matter of fact, yesterday, September 21st, was World Alzheimer's Day, and we were not in session on that occasion, so I've chosen today to introduce a bill that I hope will lead to a major breakthrough in fighting this terrible disease and treating and potentially curing Alzheimer's disease. The legislation which I have introduced this morning is called the EUREKA Act. EUREKA stands in this case for Ensuring Useful Research Expenditures is Key for Alzheimer's. And I'm taking this moment, Mr. President, to discuss it briefly, to discuss the problem of Alzheimer's, and to ask my colleagues to get behind this legislation, this bipartisan, this actually tripartisan legislation, and see if we can create some momentum to cure Alzheimer's disease in a decade. First of all, a little bit about awareness. As we all know, Alzheimer's is a 100% fatal disease. It affects some 36 million people around the globe. More than 5 million Americans currently have Alzheimer's disease. My mother died with Alzheimer's disease, and I can tell you it is an incredibly personal trial for families who deal with loved ones suffering and ultimately succumbing to this disease. So there's the human cost, which so many of us have experienced and are experiencing, but also there's just the cost in dollars and cents. We will spend, as Americans, $226 billion from our Treasury on Alzheimer's this year alone. The disease puts an extraordinary burden on Medicare and Medicaid. As a matter of fact, 1 in 5 Medicare dollars will be spent this year on someone with Alzheimer's. Think of what we could do to alleviate the suffering that our previous speaker was talking about. If we didn't have to spend this $226 billion per year, if we didn't have to spend 1 in 5 of our dollars, of our Medicare dollars, on someone with Alzheimer's. Consider the 2013 finding from the Rand Corporation. Direct costs of Alzheimer's exceed similar costs associated with cancer and heart disease combined. According to Rush University, Alzheimer's is responsible for more than 500,000 deaths each year. Without a cure or a way to halt this disease, these numbers will continue to grow. By 2050, Alzheimer's is expected to cost $1.1 trillion per year. By then, Medicare and Medicaid could see a 500% increase in Alzheimer's spending. So we have a problem in terms of dollars and cents, and we certainly have a problem in terms of the hardship that it causes on families today. Experts say we need $2 billion a year in public research if we're going to get to this goal of conquering Alzheimer's by 2025. And we do the best we can at the National Institutes of Health, but we spend only $586 million a year on Alzheimer's research. We need $2 billion a year. We spend roughly a quarter of that amount each year with very little prospect of getting it on up 4 times what we're using now. So what's the solution? Well, I think the solution is to go to a concept that has made America great for decades and even centuries, and that's the American spirit of innovation and entrepreneurship and competition. We create, we build, we make a difference in people's lives, Mr. President, through competition and innovation. So today I have introduced the EUREKA bill, which would establish a national prize for achieving benchmarks in fighting this disease. Now, I want to make it clear that this legislation, the EUREKA Act, would proceed on a parallel track with what we're doing at NIH and what we're doing in the federal government in terms of research. It wouldn't take a penny away from the research dollars that we are currently spending on Alzheimer's and funds to attack Alzheimer's in so many ways. It would be another route for a breakthrough by establishing a competition to run parallel to the research we're doing. We will need to reach some milestones before we arrive at an Alzheimer's cure. And my bill would create a system within the government with cooperation from NIH to encourage public-private collaboration to help us establish prizes for milestones to conquer Alzheimer's. Of course, we need to remember, with prizes, we pay only for success. If we don't meet the milestones, we won't have to expend the money. I have been working, and my excellent staff has been working for months with some of the leading experts in the United States on this concept, not the least of which is the X Prize Foundation, which has done such a good job in establishing breakthroughs in other areas. So we have the support of the X Prize Foundation and as a matter of fact, the cooperation of the X Prize Foundation. In addition, we've worked with the National Institutes of Health, the Food and Drug Administration to get as much information as possible, and we think we've come up with a way to have government-funded prizes to conquer this disease. This is nothing new. The X Prize came along relatively recently, but it was inspired by previous examples of success. In 1927, Charles Lindbergh won $25,000 for his Spirit of St. Louis aircraft in a competition to achieve the first nonstop flight between New York City and Paris. He received a prize for this accomplishment. Today, aviation is a $300 billion industry. So prizes are not a new strategy. The government already invests in them in countless areas, including health. As a matter of fact, the America Competes Act gives federal agencies the authority to conduct prize-based challenges. And NIH has already completed dozens of them. So this builds on that success. I envision that a panel will be established under this legislation to set benchmarks that would get us well along the road toward conquering Alzheimer's. Successful prizable events would be things like identifying an Alzheimer's biomarker, or developing early detection techniques, or repurposing existing drugs for treatment. Things like this that would be established with a panel of experts. Think of what we could achieve if people with all kinds of expertise combined their skills inside the government and outside the government to end Alzheimer's. Think of the progress we could make toward ending human suffering. My bill is S-2067, the EUREKA Act, and I have received support from researchers, including the MIND Center at the University of Mississippi in my home state, where we're doing innovative, groundbreaking achievements every day on Alzheimer's. Other organizations supporting this legislation, the EUREKA Act, include the Alzheimer's Association, Us Against Alzheimer's, the X Prize Foundation, the Alzheimer's Foundation of America, Bright Focus Foundation, Leaders Engaged in Alzheimer's Disease, otherwise known as LEAD, and Eli Lilly. All of these organizations and companies are supporting EUREKA. We already have not bipartisan co-sponsorship of this legislation, but tripartisan co-sponsorship of this legislation because we have Republicans, Democrats, and independents already co-sponsoring this EUREKA Act. So I come to the floor today and I ask my colleagues, to talk to their health staff members. Look at this concept. Talk to us about the efforts that we've engaged in, about the research we've done, about the learned people who know what they're talking about, who've worked with us to bring this bill where it is. I hope we can create some momentum for this act soon. I hope we can attach it to legislation before the end of the year. And I hope we can put this on the President's desk sometime early in the year 2016. EUREKA can be a game changer in fighting one of the most terrible and horrible and expensive diseases we have. And so I would urge my colleagues to look at this, to get back to me. I'm going to aggressively be talking to each of my colleagues, Mr. President, and asking them to co-sponsor this legislation. I think we're on to something, and I think we are getting very, very near to achieving this goal of conquering Alzheimer's within a decade. Thank you, and I yield the floor.